All right, this week in Exercise Science Lab, we're talking about training the trapezius muscles. All right, so we're breaking down the shoulder girdle. This week, the shoulder girdle is your scapular thoracic joint. Typically, your joints are going to have kind of a bone-on-bone connection. That's going to involve a capsule. It's going to involve some synovial fluid. It's going to involve some sort of articulation of maybe a concave and a convex joint, whether it's your knee, your hip, your elbow, your shoulders. Your scapular thoracic joint is what we call a false joint. It's not a true joint in that it's just a muscular connection between your shoulder blade sitting on your rib cage and back. So the junction is actually controlled by and supported by muscles, all right? So you have your deeper muscles like your rhomboids, you have your serratus anterior muscles, your pec minor, but right now we're talking about your traps, your trapezius muscles, which are typically, it's kind of diamond shaped. So in back, it's actually going to be going from the back of my neck and skull out to my shoulder blades and then back into my spine. All right, so a trapezoid, it's a big diamond shaped muscle. We refer to the parts of the traps as your upper trap, your mid trap, and your lower trap. Sometimes you'll see that as trap 1, trap 2, trap 3. All right, so trap 1 is your upper trap. It's the easiest to train, but usually unnecessary to train. It's a strong muscle. It comes into play whether you're doing some heavy overhead presses, whether you're doing some farmer's carries, luggage walks, or a deadlift. When it comes to training your traps, you really can't beat a deadlift, because if you're going to be deadlifting your body weight, 100, 200, 300 plus pounds, that's a lot of weight. You're going to isometrically contract your shoulder blades and your traps in order to support your shoulder blades, your shoulder girdle, and your upper spine. All right? But to isolate these motions is what we talked about, because we're learning functional anatomy in lab. So what we're going to do to hit a couple examples we talked about is hitting your upper trap and mid trap with a face pull. A face pull is a good exercise because, as next week we'll get into, is your shoulder joint and your rotator cuff. The face pull both trains your mid trap and upper trap, all right? But it also trains your rotator cuff, the external rotators specifically, all right? So your infraspinatus and your teres minor. All right, so use a moderate weight. I might go to 80 or 100 pounds plus. I'll put it on 50 or 40 just to do some reps here. But for the most part, the cable attachment is going to be about chest height or so. I'm going to grab a rope with palms down. And so the initial motion is just drawing my elbows back. And what we're looking for is adduction or retraction of the scapula, meaning I'm squeezing my shoulder blades together and then back. So that's the initial motion. My shoulder joint, all right, is horizontally abducting. My traps and my rhomboids are squeezing my shoulder blades together, so my shoulder blades are retracting, all right? So that's the initial motion, and then we add the external rotation of your shoulder joint in there, all right? So it's a nice retraction into external rotation. So those two motions go together, retraction, external rotation, all right? So when I go back eccentrically, it's internal rotation and protraction, all right? So that's a face pull, and so much of our upper back, our shoulder girdle, our rotator cuff training has to incorporate, or let's say rotator cuff rehab, maintenance. It's not just doing internal, external rotation stuff. We have to incorporate the shoulder girdle into play because those two work together so much. So we call it your scapular humeral rhythm, meaning as your scapula shoulder blades move on your rib cage, your humerus is going to move with that. So when I do that face pull, I'm drawing my arms back, so I'm horizontally abducting my shoulder joints, retracting my shoulder blades, and then turning that into an external rotation. All right? So if I go play basketball, what do? I go up for a shot. I should have that elbow tucked in, but that's that motion there and shot, right? So as I'm working on something like that, that's exactly what that face pull is, and then I shoot. So how well am I supporting myself there, all right? The second one, really just to focus on your mid-trap. You can do this with a seated cable row, or maybe a dumbbell row, but I like this cable row, and all I'm doing is trying to shrug straight back. So we'll have a tendency to shrug up because your trap 1, your upper trap always wants to work. So I'm trying to relax my shoulder blades, stay horizontal with or vertical with my torso, and then I'm just going to shrug back and then retract or protract. So retract back, that's going to be more of a mid-trap a trap 2 movement. All right? All right. Then I forgot to grab a dumbbell. So if I grab a dumbbell, 12 pounds is too heavy, but that's all right. So what I'm going to do is a trap 3 raise, okay? So Charles Poliquin, certain strength coaches have popularized these, but a trap 3 raise ideally is going to train my lower trap. And if you're having shoulder problems, upper neck problems, to train your mid traps and lower traps are so important because typically we carry a lot of tension, stress, and strength in our upper traps. We want to balance that out a little bit with our mid traps and lower traps. So the motion here is going to be kind of a diagonal, kind of scapular raise, we call scapular, out to the kind of diagonal side like this. But I'm going to bend at the hips and use a dumbbell to aim for my traps. So by doing this motion, the line of my arm is going to go down kind of in my mid chest. Well, if you picture that in my back, that's going to hit my lower trap. That's the goal. So I might go over at about a 30 to 45 degree angle and then do that raise. So thumb side up and raise out to the side. Keep my chin tucked a little bit so my neck stays in line. And that's a trap 3 raise. All right? So that's going to bring a little bit of balance into your trap training. If you're doing a lot of shrugs, farmer's carries, and let's say deadlifts, you can add a face pull. You can add a horizontal shrug or retraction during your seated cable row or a standing cable row, and then add that trap 3 raise. Maybe bring a little bit more balance to your trap training as far as your accessory lifts. If your primary lift is a deadlift, you can try those out. See what we think, but that's for our functional anatomy for today. All right, and I'll see you next week. We're gonna get into a little bit more shoulder blade work and some shoulder joint work as well. I'll see you then.